Good morning, good evening, good night. It depends on where you're watching from, when you're watching. And indeed, my guest, my time is definitely ET, 4 minutes after two. My guest will tell you that its time is somewhere 3 hours, somewhere 11. It's really amazing how we do time even in one country, the United States, right? Several states are either above or below my time, ET. But let's see where that goes. And I'd like to dedicate this episode to the healthcare workers. They have been with us during the pandemic. They have worked so hard, and we need to cheer them on as the pandemic continues. And this episode is dedicated to the healthcare workers globally. Thanks to you from Canute Exploration, your topic in a podcast. I am Dr. Canute White. Today is January 28, 2002, where we see 33 degrees in Bronx. It's snowing when I look outside, and it's 70 degrees in Miramar, and 85 mostly sunny in Kingston, Jamaica, where I am from originally, and Toronto C9, where my guest is from. I realize it's something like 39 degrees, mostly sunny. My guest is a very experienced person. He will be coming to us, talking to us about a number of things that very critical as we go through this pandemic and as the healthcare workers try to do their best. And it's no other than Joe Sherman, Dr. Joe Sherman. I'm going to let Doc into the studio. Doc, what's going on? How you doing?
I'm doing well, Dr. White. How are you, Doc?
I'm good. But where are you from, really? Talk to us. Is Washington? What it's like in terms of the temperature there?
Right now I'm living in Seattle, Washington, and we have an unusually sunny day today. I don't know where it came from. Maybe it's because I'm on your show. I'm not sure. But usually it's this time of year, it's gloomy and rainy, and but today we have an unusual bright, crisp day and right around 40 degrees. So I
Of
am
course.
happy, very happy.
Yeah, Doc, let me say this. I am from you, as I said, originally from Jamaica. I live in Florida, but no, I'm reaching out to you from Bronx, New York. So you understand the challenge that I'm having,
I
right?
know you're getting hit with snow out there, I think.
Tell you, yeah, we are seeing snow here. But Doc, I'd like to find out who is Joe Sherman. Let me ask that first.
Ooh, that's a long question because I'm old. But
Yeah.
I am a general pediatrician. So I have been a pediatrician for close to 35 years. And now I spend most of my time working with healthcare workers, trying to um, help them help themselves by taking care of themselves so that they can take care of their patients and the people that come to them for help. And this is something that is at crisis level. Even before the pandemic hit us, healthcare workers of all types, not just physicians, but all types of healthcare workers were really feeling downtrodden. They were feeling exhausted and burned out. So, near the end of my career as a physician, I would like to try to give back and to help them to sustain themselves in their careers.
Interesting, interesting. But this is what I'd like to throw to you now, that your childhood. That question you never know, right?
Oh,
Tell me about your childhood.
well, I grew up in the other Washington. I grew up in Washington, D.C., and I grew up in the city in a neighborhood, was, uh, 3, 4 generations Washingtonians. So I grew up in the capital of the United States, and yet people who grew up in the city of Washington, D.C., know that it is really a small town. Um, my parents were, my father worked at the post office. My mother raised 7 kids. I was the youngest of 7 kids. We were not poor by any stretch of the imagination. I would say, but we were definitely working class family. And we lived in a row house in a neighborhood of Washington, D.C. And I grew up wanting to be different than the six siblings above me. I wanted to do something completely different from them. And yet I also wanted to be like them in many ways. But I went into healthcare because no one in my family had gone into healthcare. And
Okay.
I found that for me, that was the best way that I could use my skills to help other people. So that's what I pursued.
Oh, cool. Interesting. Before I go into the burnout situation in the healthcare system, I must say to my audience, though, those listening on your favorite podcast platform, those viewing, that even though I am Dr. Sherman is doctor, I am PhD. Dr. Sherman is a medical doctor. So I just want to make that differentiation so that they know that I'm not of your expertise, doc.
We all have different expertise.
Yeah,
I'm married to a PhD psychologist, so
right.
she
Okay,
will
cool.
not hesitate to say she is a doctor also. So I know.
Definitely. Definitely. Doc, this thing about childhood vaccine hesitancy, I call it pediatric vaccine hesitancy. I know you have worked with kids, and at this time during the pandemic, there might be some hesitancy. There are children who are saying, "Hey, I don't want to take this vaccine because it's not, worth it." We are hearing a lot. What are you hearing back in your circle?
Well, vaccine hesitancy is not something that's new. Vaccine hesitancy is something that's primarily parents that hesitate to get their children vaccinated. And that's true with childhood vaccines that have been around for quite some time. But it is especially true, I would say, about COVID vaccine because it is so new and has been brought to market fairly rapidly because of the necessity of trying to arrest the pandemic and trying to stop it as best we can. So, vaccine hesitancy is primarily parents who are so concerned about their children and so concerned about the responsibility they have raising their children that they want to make sure that they do everything they can for the benefit of their children, to help their children's health, and don't want to be responsible for anything that may go wrong as a result of their decision to try to help their children. So, vaccine hesitancy usually comes, from my perspective, from having incomplete or incorrect information about vaccines that children get.
Yeah, interesting that, and I understand exactly what you're saying. But let's go into this burnout thing. You have been working with physicians, other form of healthcare workers, as it relates to burnout. What is burnout really? What are you talking about? Let's go there first.
Sure. So I think burnout is something that people from all professions experience, but especially people in the medical profession experience it because they're dealing with such critical things with people in their helping profession. Burnout consists of three components classically people talk about. The first is emotional exhaustion. Now, notice I didn't say physical exhaustion because as doctors, we're used to working all the time. We're trained that way in medical school, residency, but it's the emotional exhaustion of having to deal with the emotional impact of people who are suffering all the time that come to us, and sometimes working in conditions that are not ideal for us, that we would prefer not to work under. So that's the first component, emotional exhaustion. The second component is depersonalization. Depersonalization is as you become emotionally exhausted, you feel like you're just going through the motions. You really are just automatically doing things throughout the course of the day, and you feel like you're not really fully present to the patient and not fully present to what you're doing. And the third component is this sense of lack of impact. Like, gosh, to its extreme is worthlessness, a sense that what am I doing? I'm not helping anybody here. I'm just like standing here People are getting angry at me. I don't have enough time. I'm just kind of going through the motions. I don't feel like I'm having the impact that I really wanted to have as a physician. So those three components: emotional exhaustion, depersonalization, or this sense of separation, and then the third being this lack of a sense of having an impact or really helping other people.
Yeah, interesting to see, oh, to hear, oh, healthcare workers have this sort of sensitization to the environment that they're working in. It's critical to understand that. But what are the leading causes of burnout in the healthcare industry?
Yeah, people really classically talk about burnout in with two factors that influence it. One factor is external factors, structural factors that have to do with the work environment that we're functioning in. For example, lack of support services, where with the electronic health record that we now all use, you see your doctor, you go see your doctor, I go see my doctor,
Uh,
and she pulls out the computer and is in front of the computer like a data entry person instead of a doctor that's really taking
uh,
care of me. So, this sense of having to do so many different things as the physician, where in the past we used to have help. We used to have people that would, if we did dictation, they would do the transcribing or something like that. Or if we have to see so many patients in short periods of time, you have to see patients every 15 minutes and you have to do this, you have to do that. You don't have, so these are structural confines that we find ourselves in. The other component of burnout is internal. That
okay.
internal sense of programming that we all have as physicians, that we have to do it all. We're responsible for everything. We can never say no. The patient always comes first. This sense of like self-sacrifice. And to be honest with you, there's a certain amount of ego involved with that. But that's the way that we were taught in our training. That's what we were role modeled. And those are
Wow.
the people that we followed. So as physicians, we don't know any other way. So those are the things, the internal component where it's kind of like this never say no mentality, and the lack of ability to try to compartmentalize, set limits, and walk away at the end of the day, and
Yeah.
also the confines of the structure that we're working under.
Doc, you have alluded to altruism here, this altruistic type of expectations from physicians. But are we well, looking on from the outside, looking in? I perhaps we perhaps not seen that sort of altruism in the especially among doctors. Doctors finish medical school, they set up a private practice, and it's all about the money. Is that something we are seeing now? Is it true?
I would say that that's predominantly a myth, I would say,
Okay.
especially now. Now, I will tell you,
Yeah.
I went to medical school in the early 80s.
Yeah.
So that was ancient history. Back then, there was we used to play this game when we were kids. It was called the Game of Life. It was a board game, and you would go around the board, and you used to go one route where you would determine what your profession was. And the highest salary on the Game of Life was physician, doctor.
Yeah.
And that was true way back when the Game of Life, back in the 60s, 70s, or whatever. Now we've gone through this transition where physicians, if you look across the board at many different specialties, overall, the income of physicians is not near as high as it is in relationship to other professions, such as anything to do with computers or technology or things like that. Now, I'm not saying physicians don't make money. I'm telling you, they
Right.
make adequate amount of money, but in comparison, they don't make as much as they used to with other professions. The other factor that's huge about this is the cost of medical education and the amount of debt that physicians find themselves in as they finish their training.
All right.
Many physicians could easily be in debt for $500 to $700,000 as they finish their training.
Yeah.
So as they go into practice, they have been used to all their lives, for about 30 years of their lives, trying to get by, trying to figure out how to save money, how to get by with very little pay. And then all of a sudden they're out in practice. And when they're in practice, the first thing they think about is, how do I make enough to pay back my loans, all of the debt that I'm in? And so there's a lot of factors that are involved with this. And I would say, for the most part, except for rare exceptions, most physicians, even though they live comfortably, and I will never deny that, never, most physicians are not the wealthiest people in the community. They're not the ones any longer
Yeah.
who are making tons of money, because they're usually now employees of corporations that
Yeah.
own the medical system. Uh, Now, there are certain subspecialists that are super specialists that make a lot of money. And there are certain categories that of people that make a tremendous amount of money. People that are in like neurosurgery or fertility specialists, or people that are very, very highly specialized. But the general physicians that you see most of, are not making that huge amount of money.
Right. So there's still this altruism that exists within the profession.
I really
Yeah. But,
believe that that's true. I know very few doctors that are in it for the money. There are
yeah.
many other ways you can go much more easily if you have the privilege of having access to education. There are
Right.
many other areas you can go into that would make more money.
Okay. I appreciate that. That go back to burnout. How can physicians actually avoid burnout? Talk to us about that.
Sure. Um, I would say the best way to avoid burnout is, number one, to recognize what it is. That's first, that you have to understand what burnout is and how easy it is to slip into that, because of our general tendency to follow that programming of never giving up, never saying no, working all the time. But I would say that in order to avoid burnout, it's so important to establish a balance in your life, and to understand and to put things in perspective, that we as individuals, as people, have an occupation, a career as physicians. It is not our identity. It is not everything that we are. I am Joe Sherman. I am Joe Sherman, who's got kids, who's a parent, who has a spouse, who loves to, watch sports and loves to do lots of things. And I happen to also be a pediatrician.
Yeah.
Now, as I was coming along in my medical career, I all thought, I am a pediatrician. That's who I am. That's who I always am. That's my identity. I'm tied up in my identity. And I happen to also, if I have extra time, do these other things in my life. So it's important to keep balance in your life. And keeping balance means really being able to walk away from work and being fully present to your family, to the rest of your life, and to be able to make that separation. So that's extremely important.
Yeah. Yeah. That's important because we as professionals, we wear different caps, right? And we have to know when to take off one and put the other on. That's critical. That I appreciate you saying that. But tell me, how has the culture of medicine actually contribute to this whole disillusionment and the whole thing about burnout?
Yeah, the culture of medicine, most of us who are drawn toward medicine, especially medical school, going to become physicians, we're drawn because we really want to be of help in some way. And we're interested in the sciences, we're interested in things like biology and physiology, things that like that. And we feel like we really want to help people. We want to be a part of that. And then we come in from all different walks of life, especially now. Many people are entering medical education from other occupations later in life, not directly out of undergraduate education.
Okay.
So we come with all of this idealism and really wanting to be of help to other people. And then in the medical system, in the medical training system, it's very hierarchical. It's almost similar to the military. You
Right.
have an attending physician who is in charge, and then you have these different residents who are under that person, and then you have interns under that person, and then different medical students. So that's very hierarchical. And as you move along in medical education, the success and the grading system is very subjective. As you go along, how you progress has a lot to do with the evaluation of how much you please the person who is in charge, your supervisor.
Yeah.
So you're programmed to please whoever it is that's in charge. You're programmed to look like and perform the way that that person wants you to. So we lose our identities sometimes. We tend to lose this sense of why we started this whole profession to begin with, because we've been programmed now to do as we were told, follow in the footsteps, do what I tell you to do, and you will do well. You will progress, you will move forward.
Yeah.
And then at the other end, we're kind of programmed to believe this way of being. Don't say no. Don't show your emotions. Keep your distance. Do as you're told. All of these different things.
Yeah.
And these are the kind of ways that we go into practice. And then when we try to bring that into real life and we're on our own, all of a sudden we're in a system that often is a business system.
Yeah.
And we lose sight because we're looking to say, okay, tell me what to do and I'll do it. And then we get broken down and torn down because this is not consistent with who we are. Someone is trying to get us to do things that are different from the way we are inherently,
Oh,
naturally as
yeah.
people. So this is where medical culture can continue to perpetuate this sense of a false self, this sense of the performer, the one that wants to look good and the one that wants to look as if they are not suffering, they are not in pain, they are not having difficulties or challenges. So very often you'll see physicians internally suffering a great deal, but they say and they try to put on this face on the outside that looks as if everything is fine.
Right. Doc, I'm from a country where you have a lot of doctors as well in Jamaica. And it seems a bit saturated after a while because everybody wants to become lawyers and doctors. All these youths, yeah. So I remember on the other side, the legal field, the Bar Association of Jamaica asked the University of the West Indies and other institutions, legal, that have students of law, to reduce the acceptance, the recruitment, because it's the profession is being oversaturated, so to speak, in the country. Why I'm saying this to you is to ask, in the United States, how do you see medicine in the context of oversaturation?
Yeah, the way it is in the US now is that there is a shift that's occurring away from areas that are primary care. For example, family medicine, pediatrics, general internal medicine. That family doctor or that general pediatrician that you go to or you bring your kids to, people who are coming out of medical school now are more attracted to professions that are more specialized. And there's several reasons why that is. There is this sense that those specialties are more prestigious as you go through your training. When I went through my training, everyone started out wanting to be pediatricians and family doctors. And when they graduated, everybody wanted to be ophthalmologists, orthopedic surgeons, radiologists, all of these other specialties. And that's what we're seeing now. The trend is that people who go through medical school, who invest so much time, money, and effort into their education, they want to go into professions where they can maximize their income and they can also have more control over their lives. And so they tend not to want to go into the general fields. And that's what we need more of. We need more family doctors. We need more general pediatricians, more people who are primary care. And so less physicians want to go into that area. And
Okay.
so we turn instead to physician's assistants or physician
Oh,
associates and nurse practitioners. So, in the future, at least in the United States, I believe our primary care will be delivered predominantly by nurse practitioners and physician assistants.
interesting. That's very interesting. Doc. Um, your experience, you're now helping doctors to deal with burnout and stress, right? Um, why are you doing this? What sort of experience that you had that channels you into this sort of, I would want to call it, humanitarian effort to assist doctors?
Yeah, you know, my story is unique. Everyone's got a unique story,
Yeah,
right? Okay. So, for me, when I was in college and I was young and I was thinking about what profession I wanted to go into, my big thing was I loved kids. I loved working with kids and I loved helping people. I loved being an athletic coach. I loved tutoring. I loved teaching. I loved those types of things.
yeah,
Um, and when I looked at those types of skills and those types of gifts, as well as that interest, those values I had, it seemed like being a physician was the way to go because that's where I could have the biggest impact.
right.
All through my training, very early in my career, I often looked over at my friends that were teachers, my friends that were counselors, my friends that were athletic coaches, and I would say, wow, maybe I want to do that instead. I don't know. No, look, I can do this in pediatrics. I can do all of that stuff and do those things on the side. I can be a teacher in pediatrics. I can be a counselor in pediatrics. I can do all of those things. So, as long as I found those jobs for me that I was able to have some say in how I practiced medicine collaboratively in a team with other people where we all supported each other, working for families who are underserved in areas of usually in urban areas, but sometimes in rural areas overseas in other countries. Those were the times that I felt most alive, most like myself.
Yeah,
And then the times when I was placed in a system that was telling me, you have to do things exactly this way. You have to see this many patients. You have to be in there alone. You have to take care of all of this stuff yourself. I found myself feeling contracted and diminished. And as I came back, our family lived in Bolivia for 4 years.
right.
And I really came alive there. I love the culture. I love the people. The indigenous people of Bolivia really welcomed our family. We had two little kids and they welcomed all of us into their community. And I felt like I was able to do all kinds of things. It was just such a wonderful experience. And then I came back to the city, back to the United States, to Seattle. I got a job in a hospital clinic in the city. And I was serving immigrant patients, mostly families from other countries who lived here in Seattle. I had a
Right.
university position. I thought that that was good. I thought that would all work out well. But instead, I found myself more isolated, more alone, less in control of the way I wanted to practice medicine. And
Yeah,
then I became anxious. I became isolated. I really got burned out completely and felt misplaced. This was not where I wanted to be. It got so bad, I became depressed, and I went to my wife. I said, I don't know if I can keep this up. I don't know. And at this point in time, I was like in my early 50s. It's like it's
yeah,
hard to start all over then.
right,
And I ended up stopping altogether and really explored what I really wanted to do. And I learned more and more about this idea that there was more inside of me than just being the doctor. And so, as long as I had the setting that worked for me and allowed me to really be my full self, then I could be the pediatrician I wanted to be. And I wanted to help other health professionals to be able to achieve that same thing, to be able to look inside of them and really examine what brings them alive, what really makes them feel comfortable in their skin as themselves, and help them find the occupation, the job, the direction to head in that allows them to live that out to its fullest.
right, right. This is Canute Exploration, your topic in the podcast. I am Dr. Canute White, and I'm sitting in with Dr. Joe Sherman. Yeah, I got that right, Sherman. All right, now, this thing about mission, medical mission, right? I hear you talking and you sound like a humanitarian, someone who wants to go out there and help, give back. In the next 10 years, I know you have retired, or have you? You're still practicing.
I practice. I just fill in here and there as a
Okay,
pediatrician, but most of my time I'm doing coaching and retreats for physicians.
fine. Later on, the next 5, 10 years, after perhaps retiring, do you see yourself going into straight into this humanitarian setting? And because you have a lot to give, you have a lot of knowledge, you're that sort of person who wants to give back.
I never stopped. To be honest with you, ever since I started my medical practice back in 1988, I have always had some connection overseas doing international global health,
Right.
and mostly in the area of primary care. First in Kenya and Uganda, East Africa, in the Dominican Republic, and then later in Central America, Guatemala, El Salvador, and then in South America and Bolivia.
Cool.
So I have continued to work with organizations that that function in Bolivia, in the Dominican Republic, as well as in Central America, and I will continue to do that work part time for the rest of my life because it brings me such joy and satisfaction to learn from other cultures and to see um, how it is that I have been privileged in the way that I have been brought up here, and how much I can learn from people from other cultures.
Yeah. On a lighter note and more of interest to me, Jamaica. You mentioned Jamaica. What was your experience there?
I
What's
will
going
tell
on there?
you something about Jamaica that is near and dear to my heart is this: that back when I was in medical school and I was really feeling lost, I lost my parents. Both parents died when I was in undergraduate college.
Right.
And I was the youngest of seven, like I said. So they did their job. They got us all to college, and they almost lived to see me graduate from college, but they didn't, not quite. And I was lost in medical school. I was really searching very much for a role model of the kind of doctor I wanted to be. And there was a Jamaican woman who was first generation. Oh, she was born in Jamaica, and then her family moved to the U.S. and to New York when she was very young. And she was a pediatrician, and she was ahead of me in medical school. And then in residency, she was one of my teachers. And she opened up a practice. I was in Richmond, Virginia, is where I trained. And
Right.
she opened up a practice in Richmond, Virginia, and she welcomed me in to help her out in the community. And she would go into the schools and teach health education in the schools. She would be involved in community programs. She would be involved in her church, all these different things. And her personality was typical Jamaican, out there, welcoming everyone, alive. And
Yeah.
she would see me, this kind of like inhibited little white man and, trying to find his way through. And she said, "Come on, Joe, come on out and be with me, be with the
Yeah.
people." And
Right.
she really pushed me to really express myself to my fullest. And she always will have a special place in my heart.
Yeah.
And I finally got a chance to go to Jamaica. I just went on vacation, but I went to Montego Bay, to Negril. I went to, I did not make it to Kingston. I only was on the coast there.
Oh, you missed
And so
something.
I
I'm from
missed,
Kingston.
but she would tell me these stories, and her parents would be so alive and so tell me everything that there was.
Yeah.
So I that's where Jamaica has a special place in my heart. She unfortunately passed away
Oh.
of cancer at a very young age. But I
Mm.
will tell you that she lives on with me in spirit always. And I will, whenever I get down on myself, I always think of what
Yeah.
Jennifer would say to me way
Yeah.
back. She would always say, "Joe, come on, quit complaining. Come on out and do something with me. Come on out and go to the school with me. Help people out. You'll feel better."
Yeah. Yeah, we're that type of people in Jamaica, and I'm happy that Jennifer had some impact on your life, and may her soul rest in peace, thanks for that. Doc, your experience, I know you may explain your experience, what is it was like, but looking into the future as it relates to post COVID, what will the profession looks like? There are several changes that you might have realized as it relates to operational changes, right? What are you seeing the profession, the medical profession in the future?
Well, one thing is that even before the pandemic hit, people who were in healthcare were already feeling burned out. Over 50% of physicians who are now practicing, according to surveys, national surveys, admit to being burned out. So that means that right now, when you go to see your physician for whatever it is, that there is a 50-50 chance that that physician you're seeing has already claimed to be burned out. And if you think about that, that is profound. So the pandemic has put pressure on us even more. And what I believe that we're going to see in the future is that physicians, and because medicine has become so complex and so technological, that there is no way that we can keep up with everything that's happening. And because many physicians now want to go into specialties. Again, like I say, I think we're going to see nurse practitioners, physicians assistants coming in and playing a greater role. And then we're going to see physicians in the future, I believe, being more in charge of teams that will consist of some nurse practitioners, some physicians assistants, some nurses, all these different types of health professionals. And so that it won't be the physician seeing all the patients all the time. It will be many other people, and perhaps the more complex patients will be seen by the physician, or the physician will work together in the team to try to manage the health and well-being of patients. And hopefully we will move more toward this sense of keeping people healthy as opposed to trying to treat their diseases after they're not healthy.
Yeah.
And so that idea of prevention, I think, will be very important. But as far as the lives of individual physicians, we as physicians need to be able to take realistic looks at ourselves. We need to say, how can we live more balanced lives? How can we care for ourselves so that we will truly be present to our patients in a more genuine and authentic way? And that's going to take structural changes within the systems we work in. And it's going to take internal changes of us setting limits and being able to be more true to ourselves.
You know that, as you have said before, as a physician, you wear several hats, several caps. So you have to know when to take one off and put the other on. However, that as professionals, you and I, we know that we might have challenges in one aspect of our life, be it our social life, spiritual life, whatever, and we might take it or try to prevent taking it to our occupational life. Um, what's up with that as it relates to medicine, to the physician coming to work one morning, having had some challenge the night before or the day before? How that physician deal with that? How should that physician deal with that?
Again, this is one of my personal beliefs, is that all of us, whether we're physicians or not, we
Right.
all need some type of reflective practice, some type of practice that helps us become mindful in the moment and helps us to be fully present in the moment. So for myself,
Right.
every morning I wake up early in the morning and I go through some physical exercises. I do some meditation, some journaling, and I spend some time really with myself. And if that's with a higher power, with your faith, with your spirituality, whatever that might be, there needs to be some connection that each of us has to this sense of everyone in the universe, in a sense of perhaps to a higher power, some universal connection that we all have. And being able to start the day that way, being able to take care of ourselves and assess, how am I doing physically, spiritually, psychologically, and taking in a healthy attitude each day that we walk in to our clinics, to our hospitals, If we just wake up, and as soon as we wake up, before our feet hit the ground, our brain is already in the hospital with the next patient and the next patient, and all of a sudden we're off to the races and we don't know who we are.
Yeah.
That's not going to be sustainable.
Yeah, yeah, and I endorse that. Doc. I have a friend in the medical system, right? She's a nurse. During the COVID, well, COVID continued, right? The pandemic continued.
Yeah.
But she had said to me about 2 months ago, "Hey, I'm tired. I had 5 persons died yesterday on my ward from COVID. I'm stressed. I'm done. Tell me, Doc, what should they continue to do? What should they start doing to deal with this sort of COVID implications?"
I will say that the COVID pandemic has changed one major thing that there's several things that has changed in our whole lives, but one of the biggest challenges that is brought to the healthcare profession, especially nurses, I would say,
Yeah,
is that because family members were not allowed in the hospital during these surges when so many people were dying, that nurses, doctors, people that were there, they had to take the place of the family members. They had to be the people that comforted at times of death. They had to be the ones that sat next to the bedside. They had to be the ones that delivered the bad news to the family, who were then angry because they couldn't come in to be with their loved ones at the time of their deaths.
yeah,
This is a tremendous emotional burden that everyone in healthcare, especially those in ICUs and in inpatient units, has had to take on. This type of trauma that you experience, and it is trauma that you experience as a result of having to go through that, needs to be processed, needs to be metabolized, needs to be somehow dealt with in whatever way that you choose to do it. And that usually it's going to take a tremendous combination of other things: exercise, talking to people.
yeah,
It could come through therapy. It could come through meditation. It can come through prayer. It can come through community. It can come through all kinds of different ways. But if we expect ourselves, and this is one of the biggest obstacles, ourselves,
yeah,
if we expect ourselves to just kind of get up, dust ourselves off, and continue as life as usual, it's not going to work. We really need to take a look back and say, what is it that we've experienced? How can we change the way the system is and the way we function as health professionals to be healthier psychologically, spiritually, and so that we can avoid this type of trauma occurring to us in the future?
yeah. Doc, in light of that, before I go into this Men in Medicine workshop, talk a bit about that and into your contacts, I'd like you to encourage, in light of what you had said just now, encourage these healthcare workers. Just give them, some sort of encouragement as they continue.
Yeah, I would just say, if you're out there and you are someone who inside really feels as if you are stressed out, you feel like you've just had too much and you just can't take it any longer. I mean, and at the same time, you feel like there's no one to talk to. You feel like you can't say it to anyone because you might appear as if you are weak, or you might appear as if you can't keep up with your colleagues, or you feel as if you may be looked on as being the one that isn't truly dedicated enough to the profession. I say to you that that is a myth, that is a false belief, that we are all human beings. We all need to be taking care of ourselves. We need to take care of the spiritual and emotional aspect of medicine that we're absorbing every day of our lives. And when I was in residency, I remember the first patient that I had who died when I was an intern, my first year of internship and my first year of residency. And I was taking care of a little baby who had AIDS. And at that point in time, we didn't know, there wasn't even the term HIV. We didn't have that term. It was in the mid 80s. And this child had received HIV infection through passage from her mom. And she was so sick and she died. And I was the primary intern taking care of that child. And I was by that child's bedside day in, day out, drawing blood, doing tests, all these different things, while everyone else was afraid to go near because they didn't know at that time how HIV was transmitted. And then she died. And I felt like I could not go to any of my colleagues, any of my senior doctors. I was totally distraught. I was totally overwhelmed. I went off to the hospital chapel and I sat and I cried by myself and just cried and cried and cried. And I didn't know what else to do. I just sat there. I said, "Oh my God, I can't believe this poor little girl, all her life in this short term, and she died. And her poor parents had no idea what was going on. And they weren't even allowed to come in and be by her bedside, similar to COVID. And yet, as soon as I finished, I returned to my job. I didn't let on to anyone that I was upset by that death because we were supposed to be taught as doctors to not show emotion and to keep going and to just keep it all inside. Well, let me tell you, you keep it all inside until it explodes and you can't keep it inside any longer. So please reach out, speak to someone, get help, whatever it might be, and just talk to somebody outside of medicine and explain your experience. And just saying that simple reaching out so that someone else can understand what you're truly going through can be a first step in getting help.
Yeah, that was Dr. Joe Sherman. He just encouraged those persons in the healthcare system, especially during this time of pandemic. We're all going through it. Doc, Men in Medicine workshop. Tell us about that. Talk to us about that a little.
Well, one thing I noticed as I began my coaching practice and coaching mostly physicians who were feeling burned out or feeling as if they weren't sure which direction to take in their careers, I noticed that 90% of the physicians who came to me were women. Now, we know that women in medicine have always had an uphill battle,
Yeah,
and women have been fighting for recognition for quite some time in the in medicine, in the healthcare fields, especially as physicians. Women traditionally are more open to reaching out for support and more open to being more open with their emotions and expressing themselves in being in relationship with other people and trying to get help. So I find that my clients predominantly are women who come to me and say, I need more balance in my life. I want to be fully present at work and I want to be fully present in my family. So then we work together to try to carve out a way that they can live out their vocation and still be able to be present at work and at home. But men, because we have been programmed by society, those same characteristics of the medical culture, which tell us to keep it all inside, don't show your emotions, stiff upper lip, get back in there and fight. That's exactly what society has taught us to do. And so, what you find, incidentally, is that there is higher suicide amongst male physicians than female physicians
yeah,
because they keep it inside all the time. They don't express their emotions, they don't reach out to other people for help. They typically, as male physicians, take on this role as the strong person. I should say we, not they. I am one of them, and I've been doing it. And there's also a stereotype of the male physician, especially in some of the specialties like surgery,
okay.
of yelling and screaming and throwing things around. And this is kind of the way that is a stereotype of that. So I am trying to reach out to men in medicine to understand that these are stereotypes. These are things that have been imposed upon us that we do not have to embrace. We can reach out for help. We can express ourselves emotionally. We can save our own lives by being able to express what we're experiencing emotionally to each other.
Yeah, Doc, it's interesting. The things that you have said. I would say some of the things, everything that you have said on this podcast. It's very interesting, and I have learned a lot. And I'm sure that my audience, those viewing, those listening on their favorite podcast platform to Canute Exploration, your topic in the podcast, will have learned something as well. I'd like to have your contact though, Doc. I see your website is scrolling across the screen as well. You could repeat it for those persons listening.
Yes, you can contact me through my website. It's joeshermanmd.com. Very simple. It's my name, joeshermanmd.com. And there you can find a lot of information and the way to contact me if you are someone who would like some assistance and like some support, some coaching, or if you are an organization that's looking to be more supportive and more friendly toward your physicians and healthcare workers that work for you. I'd be more than happy to help you do that.
And you have a LinkedIn? That's okay?
Yes,
Yeah.
that's true. The
Can
same
you repeat
thing. I
that?
LinkedIn.
Uh-huh.
Yes, and so I have articles and also resources that are also on my LinkedIn page.
Okay, and your LinkedIn is the same Joe, the
That
same,
same thing,
right?
Joe Sherman MD, Joe Sherman MD, and that's the easiest way to get in touch with me. Email is joe at
Right.
joeshermanmd.com.
Hey, hey, Doc. It's so nice talking to you, you know. And I hope that you go back to Jamaica one day
Yeah,
soon.
I will want to. Thank you so much, Doc.
Yeah, so it's nice talking to you, and I wish you all the best in your endeavors. You have been doing a good job. You know, I realize, you know, and I'm sure that persons would benefit from what you have been, what you're doing.
Thank you so much for having me. I really appreciate it.
Thank you. Bye bye. So that was Dr. Joe Sherman. He has been doing such a wonderful job. You know, I've been saying that he's a humanitarian. He is someone who will be going around trying to assist, helping the person, the profession. And trust me, we need more of Joe Sherman. I am Dr. Canute White. You were listening to Joe Sherman, and I basically dedicate this episode to all the healthcare workers. Thanks for listening.